Hello, my name is Adrian, and today I will be talking to you on how to properly code a fracture using ICD 10. Did you know improperly coding a procedure could cost the patient when upcoding or the providing service when undercoding? Properly using your ICD 10 reference book will help you avoid these situations. The ICD 10 coding system consists of the PCS coding system, which means the procedure coding system, or the CM system, which means the clinical modification system. These coding systems are used worldwide in over 100 countries. Although each country modifies the system to their specific needs, the core of ICD 10 for CM and PCS follows the same guidelines. This helped aid in quality reporting, precision, and modularization. ICD 10 ups annually October 1st, which aligns with the start of the federal fiscal year for Centers for Medicare and Medicaid Services. Today, we will be talking about the ICD 10 PCS system when determining the correct code to use when coding a fracture. You must consider 7-character alphanumeric codes. This consists of 1. The section where the procedure will be performed at, 2. The body system, which body part will be done. If I'm working in my chest area, or am I working on my ribs or my skin? The root operation, what's the purpose? The body part, your body location. The approach, how will the provider gain access? The device, the materials that will remain in the body. And the qualifier, additional attributes. Before you get started, you must make sure you're using the updated version for your ICD 10 PCS. Using an outdated version could cause you to use deleted codes or improper codes. Another thing to consider is properly reading your physician's procedure notes, making sure you're understanding what the physician is stating, as the physician is given a step-by-step guide to what procedure he's performing. This is a fictitious patient, and in no way I'm violating any HIPAA laws or violations. A 40-year-old male with no previous medical history presented for evaluation as a trauma pedestrian struck by a vehicle going approximately 25 miles per hour on a local road. The patient was thrown approximately 10 feet. His injuries include a scalp abrasion, an elbow laceration, and a right proximal humerus fracture. Again, today we'll be working on the fracture. A couple of things stand out with his procedure notes. The fracture was displaced. There was a provisional fixation. Two 3.5 millimeter cortical screws were inserted, as well as humeral locking plates. This is an example of a displaced fracture. As you can see, the bones are separated from each other. So my first code I want to look at is my section code, where this procedure will be taking place. And it will be taking place in the OR. So I would use 0. Next, my body system will be which body part, which will in fact be P, my upper bones. Next, I will be looking at my root operation, my purpose for this procedure. Some may think we're doing a repair, but in actuality, we're repositioning this patient's bones. So we will be using S. Next, we will use our remaining codes to determine the body part, the approach, the device, and any qualifiers. So my code will be 0PS C04Z. Some things I may come into contact with as far as any issues will be if my physician does not document well or is lacking. With ICD-10, we are unable to use guest codes. We can only report what is there. I hope this video was very informational when determining which code to use when properly coding a fracture. Thank you.